The advertising messages in this episode are brought to you by Breast Cancer Index, the first and only test recognized by professional oncology guidelines to predict benefit from extended endocrine therapy in early-stage hormone receptor-positive breast cancer. Can you identify the 95% of women who don't benefit from extending anti-estrogen therapy from 5 to 10 years? Breast Cancer Index can help. To learn more, visit breastcancerindex.com/ONS. You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are talking with ONS member Erica Fisher-Cartledge and 3 other ONS leaders to discuss the importance of mentorship in nursing, mentoring approaches and recommendations, and benefits for mentors and mentees. Erica is the 2021 recipient of the Oncology Nursing Foundation's Connie Henke Yarborough Excellence in Cancer Nursing Mentorship Award. The advertising messages in this episode are paid for by Breast Cancer Index. To start, let's hear from Connie Henke Yarborough, an ONS founding member and namesake for the annual award that recognizes and supports ONS members who have demonstrated excellence in the mentorship of others in oncology nursing. Hello, Connie.
Hi, Stephanie.
Thanks for joining me today. So to start us off, tell me a little bit about why you think mentorship is so important for oncology nursing.
Given some thought to that question, and I think I have to go back in history a little bit, because my commitment to the development of oncology nursing really started in 1972. And, in those days, you really didn't have mentorship programs, and there weren't that many oncology nurses. Well, in my setting, I was probably the first one. But so I think mentorship became important through contact with other oncology nurses that were working all along throughout the United States, and which eventually our connection and communication led to ONS. But I think we were mentoring each other through phone calls, meeting at ONS meetings, or other conferences that were taking place. So I think over the years, mentorship developed in many areas then of oncology nursing, one-on-one through the committees that were developed through ONS Congress. And it's today has now more formalized mentorship programs. And I think we've just evolved into a very important aspect of mentoring for oncology nurses throughout the country and now throughout the world.
That's really exciting just to hear the history of both mentorship as well as of ONS, and how mentorship played such an important role in those, beginning years of ONS and how ONS grew. So let's talk about the award that is presented in your name. How can this award help shape mentoring programs and relationships in oncology nursing?
Well, I think it has helped with the professional development of cancer nurses. I was thinking back to the past awards, and I probably should look up and see how many years it has been in existence. But, I look back at some of the past recipients, and I had connection with them and really didn't realize it until they were named a recipient of the award. But when you consider that some of them were researchers, they were writers, they were clinicians, and ironically, just like in Erica's award this year, Nancy Houlihan was her mentor. And even past recipients, I remember Jane Armour, who I had worked with in the early years and received the award. She was a mentor to Mei Fu, who subsequently received the award. So I think that it's interesting to see the connection and how mentorship has really helped the development of many of our colleagues. And also, I think that I was on the LDC, the Leadership Development Committee, several years ago. And what was clear as a member of that committee was the need to develop future leaders and developing the Young Leader Development Program. So it's clear that I think mentorship and this award will help with the future development of our young leaders as well.
I have been able to see how that mentorship, and as you so aptly talked about, the career development has happened over years just in my working at ONS and seeing some of these, whether it's the award winners or just oncology nurses come up through the ranks, and how there are so many amazing mentors in oncology nursing, both that are a part of ONS, that have been a part of ONS for a long time, and others who are new to ONS, but just the importance of mentoring and how that works and the opportunities that it does give. So what has mentoring taught you about yourself?
Well, Stephanie, that's interesting. I've thought about that. I think mentoring has almost become a habit for me. I love to work with oncology nurses and have for more than 46 years in many different capacities. But I think what I really enjoy is working with some of the younger nurses that are learning to write, to publish. And I think probably as an example is just being the editor of the COVID stories and the reflections of the nurses during the pandemic, and the first volume and the second volume that just came out. It really, first of all, I enjoyed working with those nurses that had never written before, but just trying to mentor them and bringing out their thoughts and how they shared their stories. So I think it just reinforces how much I still enjoy working with nurses and trying to find different ways that I can mentor nurses.
Well, that's a wonderful thing. And I think that I have heard from many mentors over the years, whether it's mentors that are helping new abstract writers, just how much they enjoy the process and enjoy seeing the outcome of those mentees that they work with. So what advice would you have for a nurse who's looking for a mentor?
First of all, don't be afraid to ask and be willing to learn. I remember a nurse approaching me quite a few years ago and told me she wanted to edit an issue of Seminars in Oncology Nursing. She had not really published or anything in that area. And I thought, wow, here's this young nurse who actually approached me, and I was able to help her move along. And subsequently, she has mentored many more nurses along the way in many different areas. So I think that nurses need to set a goal, identify a nurse, and be willing to learn and also receive constructive feedback. And just don't be afraid to ask a colleague. They are out there, and they'll be more than willing to help you with your professional development.
Well, Connie, thank you so much for your time and giving us your thoughts on mentorship and mentoring oncology nurses. Do you have any final comments for us today?
No, I think I wish the best for Erica. She has definitely mentored many nurses, and I want to congratulate her on receiving this award.
Thank you. Now let's hear from ONS member Erica Fisher-Cartledge, Interim Director of Nursing Practice at Memorial Sloan Kettering Cancer Center in New York City, member of the New York City ONS chapter and recipient of the 2021 Connie Henke Yarborough Excellence in Cancer Nursing Mentorship Award. Hi, Erica.
Hi, how are you? Thank you for having me today.
Oh, thanks for joining us and congratulations on your award.
Thank you.
So, to start us off, why don't you tell us a little bit about your relationships as being a mentee?
Sure. I had a really amazing experience early on in my career to very organically develop a relationship with ONS's very own Nancy Houlihan as a mentee. And I didn't really go into it seeking a formal mentoring relationship. It happened very naturally with taps on the shoulder and suggestions to go into different experiences or try different things, and it really developed over years that way. And I think sometimes people think that mentoring can needs to be very formal and you need to ask someone, but for me it was a very different experience.
Okay, well, talk to us a little bit about being a mentor and what that relationship looks like.
Sure. I think that having been mentored really in a very impactful way led me to really want to carry that forward and be that person for someone else. And I have very thoughtfully looked at people that I interact with in my career and tried to pass forward experiences that I've had and open up doors and opportunities for them, and had that same kind of informal mentoring relationship in many cases. And then in more formal capacity, I run a publication mentorship program where I've worked with a number of nurses and helped them go from novice writers to published authors. And both of those have been both different but fulfilling experiences. Some people seek out the mentoring experience, some happen very naturally, but it's really fulfilling. And I think when you've had a very positive mentorship experience, you want to be able to give that to someone else so that they can grow and benefit in the way you have.
Just having that positive experience is so impactful and really does make you want to be able to do that for someone else and be that person for someone else to watch them grow and see how it changes their career and that relationship. So those are excellent examples. Can you talk about how important these relationships have been in your career?
I have to say, I think that they're absolutely essential. I mean, for me, my mentoring relationship and the opportunities that came from that really completely changed the trajectory of my career. I remember coming in to that relationship being novice to my role, novice to pretty much everything in the professional development realm of things, and the small opportunities, let's go to this lecture together, let's go and do this, or have you thought about attending a conference, why don't you apply for this scholarship? And the small taps on the shoulder, I think, really all an accumulative effect of really changing when I look back on the type of nurse that I am, the trajectory that my career took. I certainly don't think I would be where I am today if, my mentor hadn't opened my eyes to the types of experiences that were out there for me to become involved in, and the experiences, but not just show me that they were there, support me through them and those experiences. And I'm so grateful to have had those opportunities, but also to have someone that shared their experience and their time with me so that I could develop in that way.
Thank you for that. So let's talk about your institution and how do they incorporate mentorship among nurses and nurse leaders?
So there's quite a few different ways. We're really fortunate that our institution prioritizes mentorship and really sees the value in it. We have formalized mentoring programs. We have like the publication one I mentioned, but we also have a more general mentorship program. We also have a lot of informal mentorship that happens through our shared governance structure, through different roles in the organization. And I think that it's something people talk about pretty freely. My mentor, or would you be my mentor? I'm really looking to get mentored in doing this. And so it's part of the language that nurses are using. When new nurse managers or nurse leaders come on, they're assigned a mentor to help them acclimate into their role. So even as people are moving up the career ladder, it's something that's really formally part of their development. And I think that having an institution that prioritizes it, having it really be part of the day-to-day language at all levels, really brings forward how important that is for nurses to have in their career.
That's really impressive that your institution has that. And like you said, it is part of the day to day language and part of what people expect. Have you seen the kind of effect that this has had on both mentors and mentees?
It's really incredible because I think that sometimes people entering a mentoring relationship think that it's unidirectional, right? The mentor is giving something to the mentee. And really those relationships are so bidirectional. And we hear it time and time again that the mentors will share how much they get out of the experience as well. There's a mentoring relationship that really sticks out in my mind to me. A new nurse to the organization, new to the New York area, sought a mentor who was really well established in her career to help her build a professional network in the area. And at the end of their kind of formalized mentoring experience, they were in a formal program. The mentor said, I think I might have gotten just as much, if not more, out of this experience. I'm completely technologically challenged, and my mentee is like a computer superstar. And every time we met, she was teaching me something new. And, it wasn't why they entered into that mentoring relationship, but both of them walked away with one, such a positive experience of mentorship, but also a deep relationship and a mutual respect for what each had to share with each other. And I think that time and time again, we hear that and we see that. And it's so nice for people to really realize that it's more than just one person getting something out of that experience.
That's a great example that you just gave, and some really important points. And as you were mentioning that, I was just thinking, in nursing, we utilize evidence based practice so frequently in how we care for patients. So I'm sure in, a mentoring relationship, there are things that we need to keep in mind. So what would you say are some best practices that both the mentors and mentees can keep in mind in this oncology nursing relationship?
I think it's really about communication, like any relationship. Really clear expectations. What are you seeking to get out of the relationship? As a mentor, what are you able to give? I find that the more people that I enter into mentoring relationships with at the same time, I need to be cautious about, making sure that we're on the same page, right? With what I can provide time wise and resources, because I don't want someone to have, a disappointing experience because they think we're going to meet every week and I can only meet once a month. And so I think having a really upfront conversation about what the mentee is seeking to obtain from the experience, what the mentor is able to provide. I think having a way that you're going to approach that relationship together, is it going to be formalized? Is it going to be informal? And then really holding each other accountable to that relationship so that one person's not giving more than another. I think in many ways, mentorship relationships are like a good marriage, right? And everyone's bringing something to the table and being respectful of the other person and their contributions. And, oncology nursing is such an important specialty. And at the end of every one of those encounters, right, is a patient. And so the more we help each other be the best at what we can do, the better it is for the patients. And I think that that's something that should be at the forefront of all of those mentoring experiences.
Thank you again. Some more good points, and really important, like you said, to set those expectations. And talking about even setting expectations and all of the benefits that come out of a mentoring program, Let's talk a little bit about the challenges and what are some of those challenges that nurses face in a mentorship program, and what have you found that can overcome those challenges?
I think the number one challenge is always time. And I think that that's, universal for so many things that we become involved with, is that for clinical staff, it's hard to get time away from patient care to engage in these type of activities. And so some of that, has to be a commitment to sometimes do outside of work hours. I think that another challenge along with time is often that it can be really difficult for people to get constructive feedback or negative feedback. And it, depending on the type of relationship you're in, that's often sometimes part of the experience. So for example, when I'm working with a novice author and I'm giving them edits or feedback on their manuscript, my goal is to make that the best manuscript that it can be before it goes to a journal to be looked at. And part of that is not necessarily, telling everyone that everything is perfect or great. It's being able to challenge them to take their work to the next level. And that can be hard for people to hear. They can be really close to the content and not open to edits or moving things around. And, one of the things I've learned to do from, these experiences is right up front say, this can be a very personal experience, right? And it can be hard to get feedback. This is what I'm committing to do for you and with you. And, I know it might be hard for you to receive sometimes, and you can tell me that, but we're in this together and I need you to be open to be receiving feedback, because that can be hard. And it's a skill that takes working to get, constructive feedback and be able to receive it and use it to take yourself to the next level. And I think sometimes when people aren't ready for that, they can shut down in a mentoring relationship. And if you're really open to hearing things that you can be or do better, you really can excel.
Those are some really important ways to overcome the challenges that you talked about. And you really mentioned something that I think in a mentoring relationship is probably at the foundation of those type of relationships, is being able to go into that relationship knowing that you're asking this person for help to make you better in whatever area that is. But in becoming better, we sometimes have to hear the hard stuff, and knowing that that is part of this journey that you're going to take with someone is really a good and important thing to know upfront, because you're right. Sometimes people shut down with constructive criticism, and we have to learn how to accept that and know that it's not being a personal attack, but just these are some ways that, if you want to excel, that you can do better. And I think, what thinking about that on both sides of both the mentor and the mentee, while the mentee has to be willing to accept that, the mentor has to be able to deliver that in a way that they will accept it or
Absolutely. I really think giving feedback is a very important skill for mentors to work on and develop, because if you don't do it right, it can really affect the relationship.
agreed. I agree with that. So let's talk a little bit about the issue of nurse burnout and compassion fatigue. How do you think establishing a mentor mentee relationship can help support nurses when they're experiencing this?
It's a really great question, because especially right now, I think nurses are experiencing record levels of burnout and compassion fatigue. And, really when you think about what causes them, it's that giving, 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 and your own cup isn't necessarily being refilled at the same pace that you're pouring out, right? And a mentoring relationship is that opportunity to refill your own cup. It's about doing for yourself, helping to grow yourself and challenge yourself and do something new. But it puts you first. And I think as nurses, we are always giving and caring for other people. And it often becomes the only thing that we're doing. in that professional setting. So I think when nurses enter a relationship and they seek to achieve something new or try something new, it really gives them that point where they can put them first again, and refreshes their passion for oncology nursing and for nursing in general. And so I think that often when someone's feeling a little burned out or fatigued, they can think like, oh, it's just one more thing to do. But it often, I think, can be the antidote in so many ways. And it's something I would absolutely recommend. We've had some nurses, just sometimes the time away from the clinical environment to meet with their mentor, talk with them about things that are going on, can give them a perspective outside of themselves that can help them work through a really challenging time. And that alone can be really beneficial when someone's going through that.
Those are some really good points. Again, thank you. The advertising messages in this episode are brought to you by Breast Cancer Index. Joint pain and hot flashes, mood swings and weight gain. Breast cancer patients on anti-estrogen therapy know all about the side effects, which is why the decision of whether to stop therapy at 5 years or to continue through 10 is so vital for so many women. Breast Cancer Index is the guideline-recognized genomic assay for evaluating the duration of anti-estrogen therapy, a modern predictive tool that removes the guesswork, validates decision-making, and improves patient compliance. Breast Cancer Index, the modern guideline for extended endocrine therapy. So now let's talk about your approach. What is your approach to mentoring young nurses?
It depends a little bit on the person. I think it depends a little bit on what type of mentorship they're seeking. I've had people as early in their career as applying to nursing schools, and we sit and we talk about what their passions and interests are, and then look at the schools they're looking at, and how to kind of sort through that experience of going into a nursing program. And I have brand new novice nurses who are just learning how to deliver care and do time management. And so my approach with them is a little bit different. It's more about skills and techniques that they can apply. And then I have nurses that are very established as nurses, but very young in their experiences of really growing a professional network or becoming engaged in a professional organization, writing, presenting. And for them, I'm able to really try to take experiences they've had clinically and draw comparisons to then what that's like in the professional setting of whatever pursuit we're working on together. And so I think that there's no one size fit all for how you approach mentoring someone. I think, about being open, about being willing, but also I think not saying yes to everyone. I think this is hard, but if you're a mentor that's overstretched by supporting a lot of different people at a lot of time, the quality of the mentoring experience that you're able to deliver to someone is not going to be the same. And so I would, implore mentors to feel that it's okay sometimes to say that you might not have the bandwidth in that moment to mentor someone, and not just then turn them away, but help them find a new mentor if you're not able to fulfill what their need is. But I think that really being self-reflective on if you can commit to someone and give them the experience they deserve in that mentoring relationship is important. And that's something that I'm always thinking about when I'm, approached or about to enter into a new mentoring experience. Like, can I really give them the time that this person needs to have the right experience that they deserve? And, making sure that before I commit to them, that I can really fulfill that commitment. And so I think that's the first thing I approach every mentoring relationship with.
Such good suggestions for folks that are wanting to become mentors, and also for those experienced mentors. And just kind of as a reminder, I think we have such a broad audience of listeners to our podcast that you've really brought up some really good points. And, the not saying yes to everyone is so important. It's so important to know what you as the mentor have on your plate, because as you said, even with the burnout, if you don't have enough room to put that on there and you're trying to just add something on because, it might be the right thing to do, but, I'm not sure I have enough time. It's so important because that relationship and some of the things that you've already shared about how that experience is going to be for both of you is going to be impacted by your ability to know what you can take on, as you mentioned. So, those are some really good points. You've mentored several nurses through writing and publishing experiences. Why is this so important to support the next generation of nurse writers?
Oh my goodness. So, for so many reasons, when we talk about publishing, there are just an innumerable number of benefits. And one of the biggest is for our profession, right? Nursing started as a vocation. And what really helped propel it into a profession is that we have a body of knowledge that our practice is based on. So, for oncology nursing to keep growing and evolving, it needs to continue to have a body of knowledge that guides how we care for patients. And so that only happens when we continue to contribute to the body of literature through publishing. One of the things that is happening right now is we have a huge number of experienced, senior, tenured nurses leaving the clinical environment for retirement. And with them, their expertise, their knowledge, their publications are what's going to continue to be there for the novice nurses as they grow. And we need to then start those novice nurses contributing to the literature as well. And so I think that starting people early in their career, recognizing the benefit of publishing and helping support them in disseminating their work is really crucial to what we do. There are also so many other benefits, right? At the individual level, the confidence, the external validation of the work you've done, building your writing and communication skills. I mean, the list goes on and on. But I really think when we talk about the future of oncology nursing, that there is no way that that can happen if we are not routinely contributing to building that body that we make decisions off of. Evidence-based practice, there's supposed to be at least 90% of our decisions are supposed to be made based on evidence, according to the Institute of Medicine. That only happens if there's evidence to base the decisions on, right? So part of driving evidence-based practice forward is also our contributions to that body of work.
Thank you. You've given us so much information in this short amount of time, and your passion for mentorship is so evident in our discussion. As I said, we have a really broad audience that listens to us, and there are going to be nurses who are looking to start mentorship relationships. What kind of advice do you have for those nurses?
Do it. That's the biggest thing. It doesn't matter how long you've been a nurse, you can always get something out of a new mentoring relationship. I think that's the first thing. Sometimes people think, oh, I've been doing this for 20 years. I've been doing it for 30 years. Like, what do I need a mentor for? Everyone can use a mentor, a life mentor, a professional mentor, someone that just challenges you to think differently about what you do, to try new things, to get different experiences. But I also think if you're not sure who should be your mentor or how to seek out one, talk to the people around you. One of the ways I get the most, referrals or the most connections in my organization is when people talk to each other and they say like, oh, who helps with publishing? Oh, who's really good at this? And people's names, the names come up. Those are the people that you can then go to. People know, who's good at what different skills. Every organization has different experts for different things. So if you're not sure who you should seek out or who's good at the thing that you want to be mentored in, ask people around you. And if you're not sure, there is no lack of amazingly skilled people in the Oncology Nursing Society membership pool, from the local chapters to across the country. We have some of the most talented, incredible nurses in our organization, and they're always so willing to put their hand out and help another nurse along in some pursuit, using the ONS communities to make connections, the chapters, and just through the different different events, even the virtual events, have great opportunities for networking. I cannot say enough about the relationships that I've built through ONS and the experiences that I've had. And they're from people all over the country. My very first writing mentor was through the C. John Writing Fellowship. And from there, I have, many, many more publications since then. But that first mentoring relationship, I was able to, be given that opportunity because of ONS, because of CJON, and it really propelled me forward into something that I'm so passionate about. And now I'm able to pay forward by being a mentor to others as they write. So you never have to worry if you want to enter a mentoring relationship that there is someone out there to mentor you. If you're an oncology nurse, there's an oncology nurse that can help you.
Well, Erica, thank you again. You have definitely encouraged a lot of us to look for that mentoring relationship. And I really appreciate that. And again, congratulate you on this award. And do you have any final comments for us?
No, just thank you so much for having me today. This award is such an honor to receive. It really is so meaningful to me, but I think most especially meaningful because I've been able to be there and see my mentor receive this award and many people that have helped me in my career. And it's just very humbling to then be one receiving it. It's really very special, and I can't thank the Oncology Nursing Society enough for the opportunities and support throughout my career that I've received. And I'm really happy to be able to share some knowledge and insights and, along the way for others.
Thank you, Erica. Now let's hear from ONS President Nancy Houlihan. Nancy also received an Excellence in Cancer Nursing Mentorship Award in 2014. Nancy is also Erica's mentor. Hi, Nancy.
Hi, Stephanie.
So, as past recipient, can you tell us how the award has enhanced your career, both as a professional and as a mentor?
I'd be happy to. First, I must say it is an honor to be included in this podcast to talk about mentorship with two extraordinary mentors, Connie Yarbrough and Erica Fisher. Receiving the Connie Yarbrough Mentorship Award from the ONS Foundation was humbling and one of the highlights of my career as an oncology nurse. Connie is the quintessential mentor as a leader in ONS and an oncology nurse across the world, and as an editor for her many publications, including seminars in oncology nursing, where I served on her editorial board. I learned so much from her about leadership and publishing. She mentored me to pursue leadership positions at ONS, including my current role as president. My relationship with Connie changed my life as she helped me to develop in ways that moved me beyond my comfort zone, the role of any mentor. She has inspired me to do more leadership mentoring to secure the future of ONS.
Well, you definitely have some great experiences that you have had with Connie. And so, just even in that answer, you can hear how much that has meant to you and what it has done, like you said, for your career. So, tell us some more about the relationships you've held as a mentor. Like, what is the best part about being a mentor to nurses?
Well, I've had many formal and informal mentoring relationships with nurses throughout my career, both with graduate students and nurses in clinical practice. In my 20 years as a clinical nurse specialist, I had long-term mentoring relationships with many direct care nurses, and probably those were the most meaningful. At my organization, through our shared governance councils, I was able to mentor many nurses in development of new policies and evidence-based practice standards for cancer care. As this work completed, I was able to move them on to write and submit abstracts for presentations at Congress or for publications. As a result, we set up a mentoring program that connected direct care nurses with a mentor for this purpose, and then recruited the mentee, into the next group of mentoring for the future. The benefit was really ensuring sustainability of mentoring and the career development of direct care nurses. I was able to follow many of these nurses as they moved on to guide their colleagues make that same journey. It was very exciting for me as a mentor to see the ongoing impact of that initial mentoring experience with professional development.
That's such an important thing to have. And, as that direct care nurse, and maybe younger nurse in practice to be able to have a mentor that will guide and really show them and encourage them in their professional life is just such an important and valuable thing to have. But part of being a really good mentor is, the approach that you use and how approachable you are to being that resourceful mentor. Can you talk about what your approach was?
I'm a process person. So I really believe in structure and very carefully defined expectations with scheduled meetings and scheduled communication points. Especially setting out with someone who hasn't had a mentor in the past, I think it's really important to kind of put that structure into place so everybody knows kind of, what each other kind of is contributing. I also really believe in the freedom of access. I always tell my mentees not to spin their wheels, but to reach out for help rather than reach that frustration point that comes along in every project or goal that we're working on. I had a child with learning disabilities and learn the importance of helping people move beyond their barriers or their limits. So I always, kind of encourage, the outreach for feedback or for help in a mentoring relationship to help people to kind of move beyond those difficulties that always exist.
You've talked a little bit about some of the benefits that you received as the mentee from
Mhm.
Connie. So, what are some of the benefits that you see that come from mentorship, both for the mentor and for the mentee?
There are like so many rewards from both relationships that they're hard to count. Sure, can mentoring relationships go badly? They are when the relationship is not what it should be. But I think, when I think about, kind of both experiences through my life, I really think about the friendships that I developed with people that really enriched my life. And so when the mentoring relationship is what it should be, both for the mentor and the mentee, there builds a bond there because of the trust that and the vulnerabilities that are on the line. And, kind of when it all goes well, as most of the time it does, I have to say, those lead to relationships that are really lifelong. And so I really value that from both sides of that coin. As a mentor, seeing people stretch to exceed their goals are incredible. It's just incredibly rewarding. And as a mentee, obviously, the career growth that you gain from it, the success in meeting your goals, are so important to your career development. And it leads to a lot of gratitude for how you were assisted and then willingness to reach out a hand to others. And so this continues in this cycle that I just believe in nursing, probably other, certainly in academic settings, you see the same thing. But in nursing, you see it at the bedside, but you see it in more formal relationships of career development where there's, kind of reaching back and giving back to other nurses from the positive experience that you've had in your development in these relationships.
Those are really amazing benefits. Just having worked at ONS and watching some of those mentorship relationships happen in so many different ways, and they are just amazing to see. And I will say that I agree with you that the friendships that come out of those mentorship experiences seem to be some of the strongest and most rewarding pieces that come out of those experiences. So, what recommendations do you have for mentors and mentees looking to form mentorship?
As I said, I think clear expectations for each is essential. Understanding the goals of the relationship is key to measuring the growth and achievement. And I really think it's important to evaluate each other in the relationship what works and what doesn't. Certainly there are studies looking at mentoring relationships, and that is key, that there is this, kind of flow of feedback that the mentor and the mentee invest in. The mentors need feedback, and it's a really important part of the experience, and one frequently that I think gets lost. But I think, certainly in my own experience, hearing back from my mentees was a really important part of my own development, and, things that I brought to then future relationships.
Well, Nancy, it has been a pleasure talking with you about this today. And I have had the pleasure of working with you on several projects at ONS and have been able to see and experience how you work as a mentor. And I have appreciated that as well. And do you have any final comments for us today?
Well, thanks, Stephanie. That's ditto to you. I forget who said this more eloquent than I am about to say it, but nobody succeeds in life by themselves. I am grateful for all the mentoring experiences of my career, but I just want to make one particular note. I have had the privilege of working with Erica Fisher for 10 years. She is a brilliant and inspiring nurse and person. I had the pleasure of watching her develop from a new oncology nurse to a valued clinical expert and teacher, as well as a gifted leader. Her eagerness to grow, to seek direction, and to integrate feedback were the keys to her success, and something I have watched her give back to others time and again. I may have mentored her, but it is I who have grown in our relationship and continue to learn from her. So just congratulations, Erica, for this very well-deserved award.
Thank you, Nancy.
Thanks, Stephanie. It was always wonderful to talk to you, especially about this really important topic.
You too. Finally, Tracy Goslin, Chief Nursing and Patient Care Services Officer at Duke University Hospital in Durham, North Carolina, member of the North Carolina Triangle ONS chapter, and president of the Oncology Nursing Foundation Board of Trustees, joins us to share a few words about the Connie Henke Yarborough Excellence in Cancer Nursing Mentorship Award and the Foundation's mission. Thanks for joining us, Tracy.
Thank you. On behalf of the Oncology Nursing Foundation's Board of Trustees, I'm delighted to take part in this exciting podcast presentation, which represents a very special approach in 2021 to celebrate one of the Foundation's most prestigious awards. Every year now for over 2 decades, the Oncology Nursing Foundation has bestowed this special award on an exemplary individual who demonstrates excellence and inspiration in cancer nursing mentorship. This award was established in the name of founding member and celebrated leader of the Oncology Nursing Society and Foundation, Connie Henke Yarborough, a true champion of our specialized practice and a mentor to many aspiring oncology nurses. Her contributions to the field include championing the founding of the Oncology Nursing Foundation, which has supported oncology nurses since 1981. As the Oncology Nursing Foundation celebrates its 40th anniversary this year, we thank all of our supporters for helping us to support cancer nursing excellence through programs such as this award. Thank you for listening in today.
This episode was brought to you by Breast Cancer Index, the only guideline-recognized test for extended endocrine therapy. Go beyond the traditional clinico-pathologic factors with the only tool validated to inform decisions about extending anti-estrogen therapy from 5 to 10 years. When 95% don't benefit from extending, 100% of women deserve to know. To learn more, visit breastcancerindex.com/ONS. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.